The next step is to fit the lower tray to your patient. Following the first steps of warming up the lower tray, as you did with the upper, you want to take the lower tray in while it's still transparent and get it prepped to be seated. The way you can tell this is the lower tray is that there'll be pads going over the occlusal surface. With it still being transparent, and again with Vaseline on your fingertips, you're able to form it nicely and get it prepped to go around it. The instructions you give the patient is critical. You want to lift your tongue up, get the tray seated, and with their tongue up, you want to seat the tray down, guide it into place, guide the lingual side in, have them go ahead and rest onto that, making sure the midline is centered to the nose, lifting the lips up and going around it, and having the patient close down, create a seal, sucking your lower lips in, pushing your tongue down and forward. You want to leave that into the mouth for about 20 to 30 seconds. Again, keeping an eye to make sure that this is centered to the midline. Once 20 to 30 seconds has passed, you can go ahead and open and continue to contour and mold the rest of the trays around the teeth, making sure a good fit both on the lingual and on the buccal sides of the teeth. Go ahead and close. You want to keep that in the patient's mouth until it is clear. While it's still clear, it should start to turn a white milky color. When it gets to that white milky color, it's no longer able to be formed. It's now starting to set. You can then initiate it and begin to remove it. Or if you want additional undercuts, continue to keep it in there until the entire arch is no longer clear and is more of a white milky color. Once it's set, go ahead and remove it by pushing up in the back and lifting up slightly. And you'll notice that it's taken shape already, and you can put it in cold water and it'll turn to that white milky color.